So really going into like the epidemiology, like what's the prevalence? How much of this is out there in the world, in our country even? So we know the alcohol use disorder has the amount of people having alcohol use disorder has been rising before the pandemic. Just in like a decade from like 2001 to 2012, it's about a 49% increase. Now then we hit the pandemic, and you can see here, a lot more people were getting sicker. A lot more people were having alcoholic liver diseases. And there's a lot of postulations. A lot of people wondering, why did this happen and things like that. Well, we know that, this was a global traumatic event, COVID-19, the shutdowns and everything like that. So, that increased it. And therefore, with the increase of alcohol use, we saw about 24 to 27% increase in ICU admissions for what we call acute and chronic liver failure from alcohol. And about 57% of admissions were contributed by alcohol with patients with liver disease here. And the women had a higher rate of increases in alcohol admissions and deaths. And alcoholic liver disease became the number one cause of liver transplantations from the pandemic and to this day right now, that we're seeing right now. So like we talked about, why did alcohol use disorder increase? Well, this was a massive traumatic event. And a lot of what we see in our patients with alcoholic liver disease is that, they have underlying depression or anxiety or stress. And that's where, this is a quote unquote legal drug that patients are using, our community is using to deal with this stuff, to self-medicate. Of course, with we see a lot among the financial security, unemployment that kind of increased with COVID pandemic. We had a lot of psychological distress and isolation. And during the COVID pandemic, things like inpatient rehabs and even AA were kind of curtailed during that time. So it made it difficult for people to get treatment during COVID as well.